Heads up.
Hello everyone, bonjour à tous. La dernière année a été difficile, mais ce qu'on a vu, c'est que les Canadiens sont là les uns pour les autres. Tout au long de cette pandémie, on a su qu'on pouvait compter sur nos voisins et sur nos proches. Que vous ayez fait l'épicerie pour une personne dans le besoin ou que vous avez simplement porté un masque pour protéger vos collègues, je veux vous dire merci. C'est en aidant les gens qui nous entourent qu'on va réussir à traverser cette crise. Unfortunately, some people are still choosing to join large gatherings or even go out of their way to protest public health measures and disrupt vaccine appointments. But here's the thing. The reason so many Canadians are following public health measures isn't just because they want things to get back to normal. It's because they care about their neighbours and about our frontline workers. It's because they know people who are vulnerable, people who could die if this virus keeps spreading. These protests are supposed to be about getting back to normal, but by spreading the virus, they do just the opposite and prolong lockdowns. So follow public health advice, but don't do it for me or for any politician. Do it for someone in your life that you care about. Do it because you respect your fellow Canadians. To the millions of people who are already doing this and who are stepping up to look out for those around you, thank you. As you do your part, know that we have your back. Across the country, we're deploying additional support to provinces and territories that have been hit hardest by this third wave. For Alberta, we continued reaching out to the province through the weekend. We're offering whatever help they need to get the situation under control and keep Albertans safe. For the GTA, the second team of healthcare workers from Newfoundland and Labrador will arrive at Pearson this afternoon on board a Canadian Armed Forces airplane. They'll join the first team that's already there, as well as the Armed Forces members who are helping in Toronto hospitals. And for all Canadians, we continue to deliver PPE, rapid tests, and of course, vaccines. We have now delivered 16.8 million doses of COVID-19 vaccines to the provinces and territories. This week, just like every week in May, we're receiving 2 million doses from Pfizer alone. Already 1.3 million doses of this week's shipment have been delivered to the provinces and territories. For Moderna, we're picking up our next shipment tonight in Europe, and by tomorrow morning, 1 million Moderna doses will be on the ground in Canada. Almost all of these doses will arrive in provinces and territories by the end of the week. En tout, plus de 3 millions de doses de vaccins vont être livrées cette semaine. Chaque jour, de plus en plus de gens se font vacciner. Chaque dose nous permet de protéger une autre personne. Chaque dose est un pas de plus vers la fin de cette pandémie. Remember, all vaccines in Canada have been approved by Health Canada. Our advice to provinces and territories and to Canadians has not changed. Dr. Tam will have more to say in a few minutes, but make sure you get your shot as soon as it's your turn. Already, we're seeing how vaccines, along with public health measures, keep people safe. We've administered hundreds of thousands of vaccine doses in hundreds of Indigenous communities. Cases are now falling quickly in places across the country. In fact, for First Nations communities alone, active cases are about a sixth of what they were at the end of January. This is not a coincidence. Vaccines work. From day one, our top priority has been keeping people safe. And as long as this crisis lasts, that remains job one. In Budget 2021, we laid out an additional $1.2 billion to finish the fight against COVID-19 for Indigenous communities. This will go towards everything from hiring nurses to getting PPE to the front lines. Dans le budget de 2021, On prévoit aussi investir plus d'un demi-milliard de dollars dans une stratégie en matière de santé mentale et de bien-être pour les Premières Nations, les Inuits et la nation métisse. La santé mentale, c'est tout aussi important que les autres aspects de notre santé et chacun mérite les soins et le soutien dont il a besoin. En fait, en ce début de la semaine de la santé mentale, je tiens à rappeler à tout le monde que si vous éprouvez des difficultés, vous n'êtes pas seul. Demandez de l'aide. Vous pouvez toujours consulter le site de l'Espace Mieux-être qui vous offre en tout temps un accès gratuit à des ressources et à du soutien. Vous pouvez créer un compte en ligne ou vous pouvez appeler le 1-866-585-0445. Encore une fois, 1-866-585-0445. Pour les peuples autochtones, il y a aussi la ligne d'écoute Espoir pour le mieux-être qui offre du soutien dans plusieurs langues. Pour joindre la ligne d'écoute, appelez le 1-855-242-3310 ou visitez espoirpourlemieux-être.ca. Plus tard aujourd'hui, le ministre Miller va rencontrer les communautés au Québec pour discuter de la façon dont on peut s'assurer que tout le monde ait des chances de réussir, notamment en veillant à ce que tous les enfants reçoivent une éducation de qualité adaptée à leur culture. Le but est d'écouter ce dont les communautés ont besoin et de voir comment on peut continuer à avancer ensemble sur la voie de la réconciliation. Everyone should have access to clean water, just like everyone should have a safe home and a good job. Together, we've made progress in the past 5 years. On drinking water alone, we've lifted 106 long-term advisories since 2015. But if this pandemic has taught us anything, it's that there's always more work to do. That's why we're investing $6 billion for Indigenous infrastructure projects. Whether for roads or schools, this will close gaps that far too many people still face and support good jobs across the country. Together, we can and we will continue to move forward. En raison de cette pandémie, de nombreuses personnes dépendent de plus en plus des connexions sans fil, que ce soit pour l'école ou le travail ou pour prendre des nouvelles de la famille. Un forfait cellulaire ou une connexion Wi-Fi à domicile n'est plus un luxe, c'est une nécessité. Et c'est quelque chose que tout le monde devrait pouvoir se permettre. En 2019, on a promis de réduire de 25 % le coût des services cellulaires et sans fil. Aujourd'hui, on a vu les derniers rapports sur les prix moyens d'un forfait de données et d'un forfait Internet à domicile. Les prix ont baissé de 9 à 28 %. C'est une nouvelle encourageante. On est sur la bonne voie. Alors qu'on rebâtit à la suite de cette pandémie, on va s'efforcer toujours de rendre la vie plus abordable pour la classe moyenne. Finally, I want to recognize that May marks the start of both Asian Heritage Month and Canadian Jewish Heritage Month. As we celebrate the contributions of Asian Canadians and of the Jewish community alike, we have a lot to be thankful for. Because from dropping off groceries for neighbors to organizing PPE drives, in the last year, people have come together like never before. Truly, diversity is our strength, and it's something we must always stand up for. There is no place in Canada for anti-Semitism. There's no place for anti-Asian racism. There's no place for hatred or discrimination against anyone or any community. On est toujours plus fort ensemble, aujourd'hui et à chaque jour. Merci beaucoup. Je suis maintenant content de passer la parole à la ministre Anand. Anita.
Thank you, Prime Minister. Today, I will provide you with an update on vaccine deliveries into this country. En date d'hier, plus de 16,8 millions de doses de vaccins contre le COVID-19 sont arrivées au Canada. À ce jour, les provinces et territoires ont administré plus de 14 millions de ces doses. Près de 34 % des Canadiens ont reçu au moins une dose Chaque jour, nous renforçons notre protection collective et avançons sur la voie qui nous permettra de sortir de la pandémie. Since the early days of our vaccine campaign, our government has been keeping Canadians up to date on our plans and progress. And when Moderna informed us that there would be delays while they worked to ramp up production, we shared that news as soon as we received it. Today, I am pleased to provide some good news on that front. The 1 million Moderna doses, originally anticipated to be picked up next week, have now been picked up, and they are en route to Canada and scheduled to arrive early tomorrow morning. I can also tell you that Moderna has been working with our department at PSPC to solidify a more regular schedule going forward. This week's Moderna shipment, combined with the 2 million doses arriving from Pfizer, mean that a total of 3 million doses will be in Canada before the end of the week. And arrivals of the Pfizer vaccine continue to be on track for 2 million doses each week in May. That number ramps up to 2.4 million doses each week over 5 weeks in June. De plus en plus de Canadiens prennent maintenant rendez-vous partout au pays, ce qui apporte soulagement et espoir à tant de gens. Il est très encourageant de constater que les Canadiens sont si enthousiastes à l'idée de se faire vacciner. Maintenant que les provinces et territoires ont étendu la vaccination à des groupes d'âge plus jeunes et aux populations prioritaires, nous avons encore plus de raisons de nous réjouir ce printemps. But as Dr. Tam and all of our public health experts will tell you, we can't let down our guard. These next weeks and months are crucial as our vaccination campaign accelerates. We need to remain vigilant in our efforts to curb the spread of the virus and its more contagious variants. I would like to express my appreciation to all Canadians for observing the public health guidelines and keeping their own communities safe. Alors que les vaccins continuent d'arriver et que de plus en plus de Canadiens se font vacciner, faites votre part et continuez à suivre ces directives. Pour sa part, notre gouvernement continuera de veiller à ce que les vaccins arrivent le plus rapidement possible au Canada. Et nous n'arrêtons pas tant que chaque Canadien et Canadienne qui veut être vacciné le soit. Thank you. Merci. Miigwech. And now I think Minister Miller.
Thank you, Minister Nand. Kwekwe Unusakut, Tanse, hello et bonjour. I'd like to begin by acknowledging that I am on the traditional territory of the Algonquin Anishinaabe people. J'aimerais d'abord souligner que cette semaine est celle de la santé mentale. La pandémie de la COVID-19 a eu de profondes répercussions sur le bien-être mental des communautés autochtones, amplifiant donc les problèmes et les inégalités existants en matière de santé mentale surtout, et créant de nouvelles lacunes et de nouveaux besoins. One of the ways we can all support mental wellness is by talking about it. Speak out about it. Speak out about how you're feeling. Reach out to friends, families, and elders. And if you need help, there are people to support you. The Hope for Wellness line is there for everyone. First Nations, Inuit, Métis, children, youth, or adults. As the Prime Minister said, you can reach them by calling 1-855-242-3310, 1-855-242-3310, or connect to an online chat of hopeforwellness.ca. Telephone counseling is also available in Cree, Ojibwe, and Inuktitut. I'd like to give you an update on the case numbers and vaccines rollout in First Nations and Inuit communities. En date du 3 mai, dans les communautés des Premières Nations sur les réserves, nous avons connaissance de 761 cas actifs. Cela nous amène à un total de 26 489 cas positifs confirmés de COVID-19. Il y a donc 26 410 cas guéris et, malheureusement, tragiquement, 319 décès. Il n'y a actuellement aucun cas actif au Nunavik, au Québec, Et en date du 4 avril, plutôt le 4 mai, le gouvernement du Nunavut rapporte 85 actifs de COVID-19. Indigenous Services Canada is currently speaking with the government of Nunavut and Nunavut Tungavik Incorporated to provide significant financial support for food security and enhanced public health measures, among others. Indigenous communities are keeping up the fight against COVID-19. However, events in Iqaluit and alarming outbreaks in some communities are painful reminders to maintain public health measures. This is not over. Vaccinations remain our top defense against the virus. By prioritizing and vaccinating Indigenous communities first, we've managed to significantly decrease case counts and keep more Indigenous individuals healthy. As of April 30th, just shy of 370,000 doses have been administered in over 661 First Nations, Inuit, and territorial communities. Of that, 107,596 were second doses. That means that over 59% of adults in First Nations communities, as well as over 72% of adults living in the territories, have received at least one dose of the COVID-19 vaccine. In Inuit communities, this rate goes up to almost 80%, and the data is clear. The COVID-19 case rate has drastically slowed down as the number of vaccinated people increased. Il existe de nombreux exemples de réussite à travers le pays alors que le déploiement des vaccins se poursuit. 568 des 596 communautés des Premières Nations ont des cliniques d'immunisation en cours. Au Québec, toutes les communautés des Premières Nations ont commencé la vaccination de masse. La communauté de Ganawagé, entre autres, a terminé sa campagne de vaccination de masse la semaine dernière et dans l'ensemble, 74% des membres admissibles de la communauté ont été vaccinés. Toute une réussite. In Alberta, vaccination is well underway in all First Nations communities, and as of April 27th, 53% of the populations aged 18 and older living on reserve had received at least one dose of the COVID-19 vaccine at a rate that is over twice that of Alberta's. I'd also like to highlight the outstanding work done by the Blackfoot Confederacy in sharing vaccines to keep everyone safe. Despite the recent surge in cases in Alberta, active cases among First Nations in communities on reserve has totaled recently 223 active cases, and is encouraging to see the support and partnerships in the vaccine rollout. The Canadian Armed Forces also continue to assist vaccination teams with the accelerated pace of immunization in a number of on-reserve Indigenous communities in northern Manitoba, among others. CAF has also been assisting provincial vaccination authorities with tasks associated with vaccine administration in more than 25 communities in the Anishinaabe Nation in northern Ontario. This week in particular, CAF will be assisting in Wunumin and Piganjikum First Nation communities with the second dose of COVID-19. Miigwech, Nakumik, Marcy, thank you, et merci.
Dr. Tam?
Thank you very much. Bonjour à toutes et à tous. Last week, the world reached an amazing milestone of over 1 billion vaccines administered. And today, we'd like to give a shout out to the millions of Canadians who have been stepping up to get vaccinated, and the many among them who are actively helping others by sharing credible information and assisting in other ways. But first, the numbers update. To date, over 1.2 million cases of COVID-19, including over 24,300 deaths, have been reported in Canada. We are making progress nationally, but there are still a few tricky spots. The decline in national case counts has slowed to a less than 2% decrease over the past week, with an average of 7,900 cases reported daily. Unfortunately, the number of people experiencing severe and critical illness remains high. Over the past week, an average of almost 4,300 people with COVID-19 were being treated in our hospitals each day, including over 1,450 people being treated in intensive care units. At the same time, an average of 47 deaths were reported daily. Yesterday, the National Advisory Committee on Immunization updated its recommendations on the use of COVID-19 vaccines to include advice on the use of the Janssen COVID-19 vaccine. As with the AstraZeneca vaccine, there have been confirmed cases of very rare but serious blood clots associated with low levels of blood platelets, known as vaccine-induced immune thrombotic thrombocytopenia, or VIT, after administration of the Janssen vaccine. At this time, and based on current evidence, NACI recommends the Janssen vaccine may be offered to individuals 30 years of age and older without contraindications if the individual wants to receive a vaccine right away. The recommendations have been updated based on an assessment of the risk of it, COVID-19 exposure risk, and the potential benefit of earlier vaccination in preventing serious COVID-19 disease for various age groups. Provinces and territories are currently planning to add this additional tool to their toolbox to help end the pandemic as soon as possible. As we move through this rough period, we can be optimistic as vaccine supply expands and more Canadians roll up a sleeve. There is a real sense of hope and solidarity in the air. Recently, a Canadian collaborative movement has popped up with a dedicated website and hashtag aimed at getting more Canadians informed and motivated to get their shots. This is ourshot.ca is rallying Canadians across the country to encourage each other to replace vaccine hesitancy with confidence so that we can end the pandemic together. They have partnered with task forces and doctors serving racialized and ethnic communities across Canada to address their questions and concerns by making information more accessible, including by offering resources in 28 different languages, from Amharic to Vietnamese. Initiatives like these can inspire all of us to join the challenge that will help spread the message that by getting vaccinated, we're taking action to end the COVID-19 pandemic in Canada. But let's not forget, there are also other things we all need to be doing to keep ourselves, our loved ones, and our communities safer. Regardless of our vaccination status, we all need to continue following public health advice and maintain individual wash, mask, space practices, even as we're beginning to see the positive impacts of COVID-19 vaccines. This is May the 4th, and during the month of May, Canada's vaccine supplies are expanding. So may the 4th of immunity be with you. Thank you.
Bonjour à toutes et à tous. La semaine dernière, le monde a atteint le nombre incroyable de plus de 1 milliard de vaccins administrés. Aujourd'hui, nous souhaitons applaudir les millions de Canadiens qui se sont fait vacciner ainsi que ceux qui aident activement les autres en faisant circuler de l'information crédible ou d'une autre manière. Et d'abord, voici les derniers chiffres. Jusqu'à présent, plus de 1,2 million de cas de COVID-19, dont plus de 24 300 décès ont été signalés au Canada. La situation s'améliore partout au pays, sauf à quelques endroits où c'est plus problématique. La diminution du nombre de cas à l'échelle nationale a ralenti pour atteindre une diminution de moins de 2 au cours de la semaine dernière, soit une moyenne de 7 900 cas signalés quotidiennement. Malheureusement, le nombre de cas graves et critiques de la maladie reste élevé. Au cours de la semaine dernière, en moyenne, près de 4 300 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont plus de 1 450 dans les unités de soins intensifs. Durant la même période, 47 décès en moyenne ont été recensés chaque jour. Hier, le Comité consultatif national de l'immunisation, ou CCNI, a mis à jour ses recommandations sur l'utilisation des vaccins contre la COVID-19 pour y inclure des conseils sur l'utilisation du vaccin de Janssen. Comme c'est le cas pour le vaccin d'AstraZeneca, des cas confirmés de caillots sanguins très rares, mais graves, associés à un faible taux de plaquettes sanguines connu sous le nom de thrombocytopénie thrombotique immunitaire induite par le vaccin, ou TIV, ont été observés après l'administration du vaccin de Janssen. Pour le moment, et sur la base de données probantes actuelles, le CCNI recommande que le vaccin de Janssen soit offert aux personnes âgées de 30 ans et plus sans contre-indication si la personne souhaite être vaccinée immédiatement. Les recommandations ont été mises à jour à la suite d'une évaluation de risque de TIV, de risque d'exposition à la COVID-19 et les bienfaits potentiels d'une vaccination active dans la prévention des cas graves de COVID-19 pour différents groupes d'âge. Les provinces et les territoires prévoient recourir à ce moyen supplémentaire pendant leur campagne de vaccination pour aider à enrayer la pandémie le plus rapidement possible. Il est vrai que nous traversons une période difficile, mais il faut être optimiste. L'approvisionnement en vaccins devient plus abondant et de plus en plus de Canadiens se font vacciner. Il y a un véritable sentiment d'espoir et de solidarité dans l'air. Récemment, un mouvement collectif canadien a vu le jour sous forme d'un site web et de mots-clics dédiés visant à informer et à motiver davantage de Canadiens à se faire vacciner. ThisIsOurShot.ca cherche à mobiliser tous les citoyens pour qu'ils s'encouragent mutuellement à remplacer l'hésitation envers la vaccination par la confiance pour que nous puissions mettre fin à la pandémie ensemble. Les créateurs de ce mouvement se sont associés à des groupes de travail et à des médecins décevant des communautés racialisées et ethniques partout au pays pour répondre à leurs questions et préoccupations en rendant l'information plus accessible, notamment en offrant des ressources dans 28 langues différentes, de l'Amérique au vietnamien. Des initiatives comme celle-ci peuvent inciter la population à relever le défi de diffuser le message selon lequel, en nous faisant vacciner, nous intervenons pour enrayer la pandémie de COVID-19 au Canada. Mais n'oublions pas les autres gestes qui permettent de se protéger et de protéger nos proches et nos communautés. Que nous soyons vaccinés ou non, il faut continuer de suivre les conseils de santé publique, de se laver les mains, de porter le masque et de garder ses distances, même si les effets positifs des vaccins commencent à se faire sentir. Et en ce 4 mai et pendant tout le mois de mai, nous disposerons de réserves de vaccins plus grandes au Canada. Que la force immunitaire soit avec vous. Merci.
Thank you, Dr. New. We'll now turn to questions on the phone. The Prime Minister will be around for a number of questions from the phone in the room, and then the ministers and doctors will still be available after that. Operator, over to you.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de l'inaudible de la presse canadienne. La parole est à vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais vous poser une question sur le passeport vaccinal, le passeport pour des voyages internationaux. Je voudrais savoir si l'administration américaine vous a dit ce qu'elle en pense. On sait qu'ils ne sont pas très chauds à l'idée d'un passeport, enfin d'une preuve de vaccin pour aller au restaurant ou au concert, mais est-ce que vous savez ce qu'ils pensent d'une preuve de vaccin pour voyager à l'étranger? Est-ce qu'ils ont partagé leur décision sur ce sujet avec vous?
Merci, Lina. D'abord, laissez-moi réitérer que ce n'est pas le temps de voyager. On n'est pas rendu là encore. On espère se rendre là dans les mois à venir, mais pour l'instant, il faut encore restreindre nos mouvements. Il faut suivre les instructions de santé publique et se faire vacciner le plus rapidement possible. Chaque pays dans le monde peut mettre de l'avant des principes ou des attentes qu'ils ont pour que les gens puissent voyager chez eux. Il y a des pays qui exigent la vaccination pour la fièvre jaune, pour le choléra, pour d'autres choses. Et nous, comme plusieurs autres pays, particulièrement les Européens, on est en train de regarder si des certificats de vaccination seraient utiles ou nécessaires pour voyager une fois qu'on aura passé à travers cette pandémie. Évidemment, chaque pays va faire ses propres décisions, mais nous, on est intéressés de s'aligner avec les pays qui voudraient le faire parce qu'on sait que d'assurer la protection des Canadiens doit être la première préoccupation. Mais je ne peux pas parler pour les États-Unis et les décisions qu'eux y prendraient par rapport à des gens qui visiteraient les États.
Bon, vous me dites que vous ne pouvez pas parler pour les États-Unis.
Juste une seconde, Lina, je vais juste répéter en anglais. Let me begin by saying, first of all, that now is not the time to travel. We are all hopeful we're going to be able to get back to normal in the coming months and start traveling again. But the reality is we're not there yet. We're still very much in a third wave. We still need to get more and more people vaccinated across this country and get those numbers down. However, we also know that as people start to travel again, perhaps this summer, if everything goes well, it would make sense for us to align with partners around the world on some sort of proof of vaccination or vaccine certification. We are now working with allies, particularly in Europe, on that. But ultimately, it is up to every country to determine what requirements they expect from incoming travelers. We are looking very carefully at it, hoping to align with allied countries, but I can't speak for the United States and the choices they might make around who to welcome into their country.
Suivi, Lina?
Oui, merci. Donc, vous dites que vous ne pouvez pas parler pour les États-Unis, sauf que c'est nos voisins, c'est la plus grande frontière, c'est entre eux et nous. Est-ce que vous êtes en train de me dire que le Canada pourrait exiger des Américains une preuve de vaccin pour traverser la frontière quand les Américains n'exigent pas une preuve de vaccin pour que les Canadiens traversent vers le sud?
On a vu depuis le début qu'on essaie d'aligner avec nos alliés, avec nos partenaires, particulièrement avec les États-Unis, ce qu'on a fait par rapport aux frontières terrestres, par exemple, depuis les tout débuts. Et dans l'idéal, on aura des mesures semblables. Mais nous, notre responsabilité, c'est de faire tout ce qui est nécessaire pour protéger les Canadiens et nous allons faire tout ce qui est nécessaire pour protéger les Canadiens, même s'il n'y a pas automatiquement une symétrie avec d'autres pays. Nous allons continuer de mettre d'abord et avant tout la priorité sur la protection des gens ici au pays.
Merci. Prochaine question. Operator.
Thank you, merci. The next question is from Charlie Pinkerton from iPolitics. Please go ahead.
Good afternoon. Prime Minister, tomorrow at a meeting of the World Trade Organization's General Council, a month-old request from India and South Africa to waive some patent protections to allow poorer countries easier access to COVID-19 vaccines will again be discussed. Would Canada vote in favor of this waiver, should it come to it?
Canada well understands, Charlie, that this pandemic isn't over anywhere until it's over everywhere. And that's why at the WTO, with the WHO, with various partners around the world, we continue to work to ensure, including through COVAX and the ACT Accelerator, that there are vaccines available for people all around the world as quickly and in as large quantities as possible. I know the conversations around patent protections are ongoing, and Canada is actively participating in them, but we understand how important it is to get vaccines to the most vulnerable around the world, and we will keep working for that.
A follow-up, Charlie?
I would appreciate a more firm answer on whether or not Canada would support this, but I suppose a follow-up question would be, would vaccine passports be something that your government would be willing to create ahead of the time that everyone has access to vaccines, so before the time that everyone's had a chance to get 2 shots?
As I've said, every step of the way, we're going to make sure we're doing everything we can to keep Canadians safe. And that means following science, listening to experts on recommendations they're making. We know that vaccination is a really important part of how we get through this for the long term. And that is going to be something we're continuing Canadians to do. We need to make sure that access is equitable. We're happy to be highlighting today the tremendously successful vaccination campaigns that have been taking place in Indigenous communities across the country with full partnership of Indigenous leadership. These are the kinds of things we need to make sure that we're doing so that any steps we take moving forward are fair for everyone. But yes, as I said, we are looking at requirements around vaccination on international travel, and we will, as much as possible, align with partners and allies on these issues.
Thank you. And we'll take one more question on the phone. Operator?
The next question is from Ryan Tumilty from the National Post. Please go ahead.
Yeah, good morning, sir. I'm sure you know NACI yesterday recommended that people who can wait for an mRNA vaccine should pass on the Johnson & Johnson vaccine or the AstraZeneca vaccine because of the risk of blood clots. I'm wondering if you're concerned that that recommendation is going to slow Canada's vaccine rollout and further muddle the waters and create more vaccine hesitancy.
I think first and foremost, Ryan, I have heard, and you have heard, and we have all heard directly from friends, loved ones, Canadians in general, how eager everyone is to get through this, get back to normal, get to a better summer, end this pandemic once and for all. Everyone wants that, and we know the way to do that is to get as many people vaccinated as quickly as possible. The longer we wait, the longer it takes, the slower before we get back to normal, the slower before we get to drive down case numbers across the country. So everyone knows that we need to get our shots as quickly as possible. And I can reinforce once again that every single vaccine available in Canada has been approved by Health Canada as being both safe and effective. It is a good thing that we get to hear from a broad range of medical experts and doctors making recommendations to keep us safe. The bottom line is we need to, all of us, get vaccinated as quickly as possible so we can get back to normal. But I will turn to Dr. Tam for a follow-up on the medical aspects of that question. Teresa.
Yes, thank you for that question. And I think that Canadians should feel confident in so many ways about getting vaccinated. As the Prime Minister said, this is the key to help us get through this pandemic, is to get vaccinated. I think that it is hard for people to understand evolving science and evolving data. That's what's been so difficult for so many people throughout this pandemic. But I think I am very heartened that the National Advisory Committee on Immunization is taking the data that we're gathering in real time into account and evolving the advice based on that. We all want transparency. We all want that the data is carefully analyzed as we're going along. That doesn't make it easy for people to understand, but I think that that's a really important principle, and that as benefits and risks are weighed, these parameters could shift over time, and we can depend on NACI and our Chief Medical Officers Health across Canada to take all of that into account as they provide vaccines to everyone. We will keep learning as we go and incorporate any surveillance information, for example, that we have on serious adverse events. And NACI, I think what I heard from the Chief Medical Officers is that they are very grateful for NACI for providing them with the risk-benefit framework upon which they will incorporate the viral vector vaccines such as AstraZeneca and Janssen. And they will serve their population with the best advice as they're rolling out their implementation program. But I think that we all have to understand that everyone is trying to provide the best information in order for everyone to make a decision. What I've also heard from Chief Medical Officers is that there is no doubt in their minds, as they're experiencing a very significant resurgence in COVID-19 and seeing ICUs filled up and seeing deaths still occurring across the country, that the AstraZeneca vaccine has really saved lives, and that the vaccine has done what it was designed to do. And that the longer you wait to get vaccinated, the longer that you're not protected. Having said that, they too will take advice from NACI and others and evolve not only as our data evolves on the benefit and risk, but also adapting and calibrating as our supplies, for example, the mRNA vaccine, rapidly escalates over time. So I think that Canadians should be confident that our public health systems are providing you with the best advice and the vaccines as they become available.
C'est important juste une seconde, Ryan, je vais juste répondre en français. Je pense que tous les Canadiens veulent en finir avec cette pandémie et je pense que tout le monde comprend bien que la vaccination est une étape essentielle dans la fin de cette crise. Nous nous devons de se faire vacciner le plus rapidement possible avec tous les moyens là, mais je veux rassurer et répéter ce que les gens savent, c'est que Santé Canada a approuvé tous les vaccins qui sont utilisés au Canada comme étant sécuritaires et efficaces. Nous allons toujours écouter les experts, les scientifiques qui nous donnent des recommandations, mais l'important, c'est de se faire vacciner le plus rapidement possible, sachant que les vaccins sont sécuritaires et efficaces, tous les vaccins.
Your follow-up, Ryan?
Yeah, sir. Right now, Canadians are hearing from NACI, they're hearing from you, they're hearing from Health Canada, and they're hearing from local medical offices of health, and often they're hearing different advice. I'm wondering if you think, in retrospect, the government should have clarified the communications process so that Canadians aren't getting confused and potentially more vaccine hesitant in the middle of this pandemic.
As we've pointed out many times, Canada is a big country with very different realities in terms of pandemic, in terms of demographics, right across the country. And every step of the way, we have put out federal recommendations, but also made sure that the provincial authorities, the people closest to the ground, the people understanding the situation and the way forward best, are able to make their recommendations. We also have seen evolving science. These vaccines were developed to be safe and effective in record time, and that is saving millions of lives around the world. But also because of that, the data continues to roll in. And there's always opportunities to refine or adjust those recommendations. And that's why we're pleased to be able to continue to count on an extraordinary team of experts and doctors. Je pense que c'est important de souligner que la pandémie est différente à travers le pays. Et bien que oui, on continue d'avoir des messages du fédéral, il y a aussi un besoin direct d'avoir des experts dans les différentes provinces et territoires pour partager ce qui est plus approprié pour leurs citoyens. On a des variations géographiques, on a des variations démographiques et on doit toujours faire confiance aux experts locaux. C'est pour ça qu'on continue à travailler ensemble, mais le principe de base, c'est que oui, on va surveiller et évoluer au fur et à mesure que les données rentrent et les faits sont plus comprises, mais nous allons toujours mettre la sécurité de tous les Canadiens d'abord et avant tout comme priorité.
Prime Minister Michael Couture with Global National. I just wanted to come back on NACI sort of doubling down on this idea of preferred vaccines. As one of the 1.7 million Canadians who got one of the not preferred vaccines, I wanted to know, what do you think of that, first of all? And second of all, we're hearing from doctors that are saying that what NACI is doing right now is actually dangerous because it's going against public health guidelines. Do you think that NACI still really serves a purpose here?
First of all, let me remind everyone that every vaccine administered in Canada is safe and effective as evaluated by Health Canada. The safety of Canadians is first and foremost. And we have seen the tragic impacts of COVID-19 all across the country, and vaccines are one of the key tools to reduce the deaths and the vulnerability of Canadians to COVID-19. That's why we are continuing to recommend to everyone to get vaccinated as quickly as possible so we can get through this, so we can see case numbers drive down and we can end with so many of these restrictions. I am very, very happy that I got my shot and I'm encouraging everyone to get vaccinated because that's what Health Canada and all experts are highlighting is necessary to get through this.
Sorry, I got to follow. I just want to ask you, last week, You talked about your Chief of Staff, Katie Telford, as a strong leader when it comes to fighting accusations of misconduct in the military. You said it's because of her leadership that you call yourselves a feminist government. So why does it seem like the Liberals at the National Defence Committee are trying to prevent her from testifying? And would you be okay with her testifying?
It is unfortunate but not surprising to see Conservatives playing extremely aggressive partisan games with this issue. My focus, our focus as a government, our focus as a country needs to be on supporting survivors of sexual assault and harassment and recognizing that the systems that have been in place for many years in the military and elsewhere have not given people comfort to come forward, share their stories, and demand consequences. That is a failing that we have collectively had, particularly in the armed forces, and it's something that needs to end. We have taken significant measures over the past number of years, but as we've clearly seen, there is much more to do. And that's why we made announcements last week with Justice Louise Arbour and General Carignan to put in place measures that will make sure that anyone who experiences harassment, assault in the military or anywhere else for that matter in this country has ways to come forward, engage in a process, be supported, and know that we are serious about putting an end to the unacceptable culture that has tolerated this for far too long in our military and in other institutions. Je pense que c'est désolant de voir le Parti conservateur jouer des jeux extrêmement politiques avec cet enjeu. Ce sur quoi nous devons tous être concentrés, ce sur quoi mon gouvernement et moi-même se concentrent, c'est de mettre fin à la culture qui accepte l'harcèlement ou les agressions sexuelles dans les forces armées et ailleurs. La réalité, c'est que trop de gens qui subissent des expériences inacceptables ne se sentent pas appuyés, n'ont pas les ressources et l'habileté de venir exiger des conséquences, de partager leurs histoires. Oui, on a fait des améliorations au cours des dernières années, mais ce n'est pas assez. Et c'est pour ça que nous avons annoncé la juge Arbour, la générale Carignan, pour mettre en place des meilleures mesures de soutien pour quiconque aurait subi des gestes inacceptables. Nous nous devons de nous assurer que les femmes et les hommes qui servent dans nos forces armées soient protégés pendant qu'ils servent notre pays.
And Glenn McGregor, CTV News. Prime Minister, you've repeatedly come here in this very room and said that the best vaccine to take is the first one offered to you. Based on that advice, 1.7 million Canadians went and got the AstraZeneca shot. Now they learn that that is not necessarily true from your science advisors, that some of them should have waited to take Moderna or Pfizer. Do you understand how frustrated they are by that? What do you say to them? And what do you say to someone who's got an appointment today to take AstraZeneca and is now maybe thinking that isn't the right vaccine for them?
On a personal level, I am extremely pleased that I got the AstraZeneca vaccine a number of weeks ago. It was extremely important to me to be able to protect my loved ones, to protect my family, and to do my part to ensure that all Canadians get through this as quickly as possible. And that's the reality. We all want to get through this pandemic as quickly as possible, and that means all of us getting vaccinated as quickly as possible. That is the focus that we have right now. And again, every single vaccine administered in Canada has been judged by Health Canada as being safe and effective. The impact of catching COVID are far greater and far deadlier, as we've seen across the country, than potential side effects, which, although serious, are rare. But I'm not going to get too much into the medical advice, and I'm happy to turn it over to Dr. Tam for that. But the reality is, The way we get through this pandemic is to get vaccinated with whatever vaccine is offered to us as quickly as possible. Teresa.
Yes, as I've said, that I can certainly understand why some individuals are, concerned or getting frustrated as advice appears to be evolving. But that is the nature of science and advice. And I think that Health Canada, as the Prime Minister said, is doing their job. They just put out, for example, a notice that they are taking a very diligent look at all the information about the Janssen vaccine before they release this vaccine for use in the population. So we know that they're doing their job. The National Advisory Committee on Immunization is also doing their job. So while overall benefits and risks are such that benefits might outweigh the risks, there are differences in how you look at benefits and risks depending on the disease activity within your jurisdiction or your local community, as well as your own risk in terms of your age or your risk factors. And the local public health department also takes into account the supply and logistic and other operational elements. But I think the bottom line is that everyone should be reassured that the regulator, the experts, and local medical officers of health have all done their work in a synchronized manner to provide the vaccines to the communities, so that you should trust that the vaccine program being offered to you is done with that best knowledge, and that information should be provided to everyone to make sure you get the best informed decisions. On AstraZeneca, on Janssen, we will continue to be monitoring the evolution in information. I think for those who received the AstraZeneca vaccine, as I've said, in the time frame that we're looking at, all medical officers have said it's been a really, really effective vaccine that saved lives. And I expect the National Advisory Committee on Immunization and the Chief Medical Officers will also look at what is the best advice going forwards for those who already received a AstraZeneca vaccine, including any international evolving clinical trials and any domestic expert analysis on that second dose. So I just want to assure everyone that that advice will be forthcoming in time for when people need that second dose. But again, I'll reiterate from all chief medical officers that the AstraZeneca vaccine deployed in the middle of a third wave has saved lives and prevented serious illnesses.
Hi, Prime Minister. Tom Perry, CBC. I'd like to ask you about international travelers coming into Canada. By air, they're being funneled into 4 airports. They're supposed to quarantine when they land. Some of them aren't, though. They're taking a fine instead. When we asked PHAC how many people are taking fines, they said it's a number above 500, but they couldn't give us an exact number. Also, it seems that travelers arriving in Vancouver and Toronto are getting fined. Travelers arriving in Calgary and Montreal are just walking away without getting fined. So why is it your officials don't seem to know exactly how many people are opting out of quarantine? Why is it travelers at some airports are being fined and others not? And what are you going to do about that?
Thank you, Tom. First of all, let me remind people that when someone arrives in Canada, whether it's through an airport or through a land border, they have to show a 3-day PCR test that is negative. They have to get tested on arrival. They have to get tested again a week into their quarantine, and they do have to quarantine for 2 weeks at home. And that is for everyone arriving. On top of that, if you're arriving at an airport, you need to do a mandatory government-approved accommodation while waiting for the result of your on-arrival PCR test. These are all ways of putting in multiple levels and multiple layers to keep Canadians safe from arrivals of virus in this country and allow us to study and follow up on the statistics, on the sequencing, on the reality of where those challenges are. And for example, the system clearly showed that in the case of flights from India and Pakistan, there was a higher level of importation of people testing positive on the on-arrival test. And that's why, based on that data, we were able to shift our posture and suspend those direct flights. When it comes to enforcement, the federal government works hand in hand with local authorities. The local police have jurisdiction, and we've seen that both in Vancouver and in Toronto, or in Ontario and BC, the cooperation between the federal government and the local police has been seamless, and we've been able to both collect data and follow up on this. In other jurisdictions, the arrangements are slightly different with both Quebec and Alberta. That means we don't have the same access to the data of the local enforcement actions. But like I said, yes, the RCMP and PHAC and others make follow-up calls and are part of the checking and enforcement of the mandatory 2-week quarantine. But local, municipal, and provincial police are also part of that equation and have the full authorities to bring in fines. And we certainly hope that there will be a greater access to data that can reassure people that those fines are indeed being applied and enforced everywhere across the country. Je pense que c'est important de souligner que les voyageurs qui arrivent au Canada doivent faire un test avant d'embarquer dans l'avion. Pour le démontrer sur arrivée, qui sont négatifs. Ils doivent se faire tester à l'arrivée et ils doivent ensuite se faire tester après une semaine de quarantaine et ils doivent faire ces 2 semaines de quarantaine. Pour ceux qui arrivent par avion, ils doivent attendre dans un hôtel approuvé par le gouvernement jusqu'à ce que leur test d'arrivée revienne négatif. On a mis ces mesures à plusieurs couches et plusieurs étapes, non seulement pour empêcher les variants et les cas d'arrivée en grand nombre au Canada, mais aussi pour pouvoir collecter des données pour mieux comprendre qu'est-ce qui arrive et où il y a des défis. Par exemple, ce qu'on a fait avec la suspension des vols de l'Inde et du Pakistan était basé sur le fait que sur les tests d'arrivée, il y avait un nombre beaucoup plus important de cas positifs et donc on a pris de l'action. En Colombie-Britannique et en Ontario, on est en train de travailler très proche avec les autorités locales et on a les données sur les pénalités données. Mais en Alberta et au Québec, on n'a pas ces mêmes données, ce même partenariat, mais je sais que la police locale est en train d'avoir toutes les autorités nécessaires pour faire des suivis, pour s'assurer que des gens qui n'obéissent pas au règlement de quarantaine vont avoir des conséquences salées.
Hello, Mr. Trudeau, Man Hamidi with the Canadian Press. Sexual assault victims and advocates have complained that Liberal MPs have treated them rudely at committee meetings. Will you speak to your caucus about their behavior in committee meetings, and do you think that the rules need to be reformed to take a more trauma-informed approach?
I think it's important for everyone to take a more trauma-informed approach on dealing with questions of sexual assault and sexual harassment, on providing support for survivors. Our institutions in general, whether it be the Canadian Armed Forces or our Parliament or workplaces across the country, need to do a better job of creating a supportive environment in which people who have experienced unacceptable actions are able to come forward and engage in a process that is going to support them and get consequences for inappropriate actions, and even further create environments in which those inappropriate actions don't happen in the first place. We all have to do better. We all need to take this seriously. And I know it's something that Liberal MPs, like all MPs, want to do a better job of. Every single party seems preoccupied with supporting survivors and making sure that we are improving our systems throughout government. And I can assure you that the Liberal government will continue to do just that.
Bonjour, M. Trudeau, Juliane Lapointe de Radio-Canada. On comprend que Netflix sera exempté de la taxe sur les services numériques, qu'il n'aura pas à payer de taxe sur les revenus tirés de ses abonnements. Je vais vous demander, est-ce que vous trouvez ça juste et comment vous justifiez ça auprès des autres entreprises numériques?
On est dans une économie mondiale qui a beaucoup changé depuis plusieurs années avec l'arrivée des GAFA, des géants du web particulièrement, qui ne payent pas leur juste part d'impôts. Chaque pays, comme le Canada, a mis de l'avant une promesse d'imposer des taxes et des impôts sur les géants du web à partir du 1er janvier de l'année prochaine. Mais notre préférence, ce n'est pas d'y aller seul, mais de s'aligner avec les autres pays dans le monde pour qu'on ait tous une approche coordonnée et harmonisée. L'OCDE est actuellement en train de regarder les détails de comment se faire et nous allons nous aligner dans l'idéal avec ce que nos partenaires à l'international sont en train de faire. Nous avions promis d'assurer que la taxe de vente s'applique sur les abonnements Netflix, comme on a promis en 2019. Et nous avons aussi promis que Amazon, Google, Facebook et Apple payent leur juste part d'impôts au Canada pour ce qu'ils offrent au Canada. On est en train de travailler là-dessus. Ce n'est pas un enjeu facile, mais c'est un enjeu sur lequel, si nous sommes alignés avec le reste du monde, nous allons améliorer la responsabilité de ces compagnies de contribuer aux sociétés et à la vie des citoyens qui leur font des profits faramineux. I think it's extremely important to recognize that the world is changing and the presence of online giants that haven't paid their fair share of taxes in the countries where they are operating is something that needs to end. That's why we made a commitment to do just that, to bring in a taxation regime for web giants as of January 1st, 2022, on our own if necessary, but ideally in alignment with other like-minded countries. The OECD is working very hard on creating that alignment so that we're able to move forward, and we will ideally harmonize with what the rest of the world is doing to make sure that everyone is paying their fair share. We are moving forward with applying sales tax to Netflix subscriptions to be fair to streaming services that are Canadian. But at the same time, we will continue to look for ways to make sure that companies that are making tremendous profits off of Canadians without paying their fair share of taxes are actually held to account, and that's something we're moving forward on.
Thank you. That concludes the time that the Prime Minister has for questions. The ministers and doctors will be around for a few more moments afterwards for questions. We'll get started once the Prime Minister exits. So we'll go back to the phones for questions. Operator, over to you.
Thank you, merci. The next question is from Marika Walsh from the Globe and Mail. Please go ahead.
Good afternoon. Thanks for taking our questions. I guess my question would be for Dr. Tam. I'm still a bit confused as to what advice you are giving Canadians as they try to square the circle between the statements today on getting the first vaccine that you can get and the advice yesterday that depending on your own personal risk, you should wait for a preferred vaccine or an mRNA vaccine. How are they supposed to make sense of those two competing directives?
Well, I think they are actually, approaches that actually do converge, because what we'll be doing is that they'll be doing a lot of work in helping the public understand that the vaccine that they are providing to them has already undergone that benefit risk assessment that NACI has laid out, for instance, so that when they are rolling out their program to individual communities, for example, they've already taken into account the fact that there may be a lot of COVID-19 activity going on. That's really important that they've taken that into account already. They've, of course, looked at the data as it pertains to any, even if rare, serious adverse events. They would have also taken into account their specific circumstances in terms of their access that they're providing to the different populations. So that by the time it gets to individuals and that you're offered the vaccine, I think you've already be reassured that the local jurisdictions have done all of that work. And nonetheless, it's always part of informed consent that you be provided with all the information that you need to make that decision, because all of us are different and have different sets of circumstances. So I don't see them as being different. I just think that people should be confident in their public health system and that they are being provided with vaccines, knowing that all of that data and analysis and thoughtful thinking and the balancing of benefit and risk has been part of the consideration as vaccines are offered to them. And I do know that, Canadians have been very enthusiastic about getting vaccinated and that they are getting the information that they need. So I think we need to maintain confidence in that process and provide people with as much information as possible so that they can make an informed choice. But if you're living in PEI, you're probably not exactly the same as if you're living in Toronto, for example. So that is being taken into account as vaccine programs are rolling out.
Follow up, Marika?
Yeah, thank you for that. My follow-up question would be for Minister Anand. It seems that maybe some of this confusion is less important given that the vast majority of the shots that we are getting appears to be only mRNA in the next few months. Can you please provide us with some more information about when we are expecting the next deliveries of AstraZeneca and Johnson & Johnson and what quantities they will be in?
Yes, thank you for the question. Let me begin with the total number of doses that we expect during the second quarter, and that's actually cumulative, including the first quarter numbers also, 48 to 50 million doses prior to the end of June of all suppliers, and over 100 million doses by the end of September. The majority of the doses, as you have correctly stated, are from mRNA vaccine producers, being Pfizer and Moderna. This month alone, we are expecting at least 9 million doses of those suppliers. And overall, we have procured 44 million doses of Moderna and 48 million doses of Pfizer. In terms of the breakdown of the numbers of all suppliers for this quarter into the end of June, we are expecting 24.2 million doses of Pfizer, between 10 and 12 million doses of Moderna, just over 4 million doses of AstraZeneca, and the 300,000 doses of Janssen that are in the country at the current time, and additional doses to come in June once the manufacturer confirms a delivery schedule with us. In terms of breaking down those numbers even more, for AstraZeneca in particular, as you are aware, we receive AstraZeneca doses from multiple sources. We are expecting to receive a shipment of 655,000 COVAX doses within the next number of weeks. We have been pressing for a precise delivery date for those doses from the COVAX facility. And when we have that in hand, we will provide it to you. We are also expecting 1 million doses of AstraZeneca under our APA in the month of June. And we are continuing to be in discussions with the United States about the possibility of receiving doses from them under a similar exchange agreement that we had the end of March with them. I want to stress that at the current time, we have approximately 2.3 million doses of AstraZeneca in the country. And prior to the end of June, we expect to have almost double that amount. We will continue to press the supplier, as well as all other sources, for an expedited delivery of AstraZeneca into this country. Thank you.
Thank you. And one more call on the phone, please, operator.
La prochaine question de Boris Proulx, Le Devoir. La parole est à vous.
Oui, bonjour. Pardon de revenir sur la question de mes collègues, mais c'est encore pas très clair. Mettez-vous dans la peau d'une personne qui n'est pas dans une province ou une région fortement touchée par la COVID-19 en ce moment et qui se demande si elle doit prendre le vaccin AstraZeneca ou Johnson & Johnson tout de suite ou attendre d'avoir un vaccin à ARN messager pour éviter le risque improbable de caillots sanguins. Est-ce que vous lui recommandez A, d'attendre le vaccin à ARN messager ou B, de le prendre tout de suite?
Merci pour la question, c'est Dr. New. Peut-être je vais répéter ou peut-être je vais donner une réponse avec des autres aspects. Je pense que c'est sûr que dans plusieurs régions à travers le pays, on est dans une troisième vague et c'est vraiment grave. Je pense peut-être dans les provinces, en Ontario, Alberta, par exemple. Et c'est important d'utiliser tous les outils à notre disposition pour combattre contre la COVID-19. On a 4 vaccins autorisés au Canada. 3 vraiment on utilise maintenant parce que le Janssen Vaccine, on n'a pas encore eu des livraisons ici au Canada. Et avec les 3 vaccins utilisés, incluant l'AstraZeneca, c'est sûr qu'avec l'expérience réelle sur le terrain, les vaccins ont sauvé des vies. C'est sûr, ils sont efficaces, ils sont autorisés par Santé Canada, ils ont à prévenir les conséquences graves de la maladie et le décès. Ça, c'est facile. Et donc, pour les personnes qui ont déjà reçu une dose d'AstraZeneca, j'ai un message simple. Merci. Vous avez bien fait. Vous êtes protégés contre la COVID-19, mais aussi vous avez protégé votre famille, vos amis et aussi les autres membres de la communauté. Ça, c'est sûr. Maintenant, c'est aussi un enjeu un peu scientifique parce que, comme le ministre Lalonde a déjà précisé, si on regarde c'est quoi l'horaire pour l'approvisionnement et les autres vaccins qui arrivent ici au pays, on va recevoir beaucoup de millions de doses de vaccins. Je pense Pfizer au moins 2-3 millions par semaine. Donc, ça, c'est quelque chose à étudier parce qu'on sait que dans les autres pays, comme par exemple le Royaume-Uni, on étudie est-ce que c'est possible si on commence avec une dose, par exemple AstraZeneca, est-ce qu'on peut donner une deuxième dose avec un autre vaccin? Ça, c'est une question importante. Et selon les données comme des préliminaires, les résultats sont encourageants, mais on attend encore les résultats. Et on a aussi posé la question à la CCNI pour peut-être donner, comme il dit, un conseil ou au moins un avis expert. Donc, je pense que ça, c'est quelque chose à suivre. Et pour l'instant, je pense que pour tout le monde qui a reçu déjà la première dose, c'est une question peut-être à attendre les données probantes et aussi les recommandations. Mais c'est sûr que à l'échelle de chaque province et territoire, c'est vraiment toujours les médecins hygiénistes en chef, aussi les autorités de santé publique qui prennent en considération les recommandations de CCNI. Et eux aussi, ils ont plus d'informations. Ils comprennent bien le contexte dans leur propre province et territoire. C'est quoi la situation épidémiologique et comme c'est la meilleure façon de utiliser les vaccins disponibles dans leur province ou territoire aussi avec selon la disponibilité de l'approvisionnement. C'est ça que je pense que les Canadiens partout dans le pays peuvent faire confiance dans les autorités de santé publique qui sont en train avec le déploiement de vaccins dans leur jurisdiction. C'est facile.
Merci. Docteur New, je ne trouve pas que vous avez répondu d'une manière concrète à la personne qui se pose la question entre attendre et prendre tout de suite le vaccin AstraZeneca ou voilà. Mais je vais enchaîner et j'aimerais savoir si Santé Canada a un avis sur le fameux projet de passeport vaccinal. Ça a été beaucoup posé dans cette conférence de presse. J'aimerais savoir si vous recommandez ce genre de passeport qui permettrait à des personnes, je comprends, là, de l'étranger de venir au Canada ou des Canadiens de partir à l'étranger.
Merci pour la question. Et c'est pas Santé Canada, c'est nous autres ici à l'Agence de la santé publique qui travaille, comme on dit, à l'échelle technique, mais comme le Premier ministre aussi a constaté, on continue à travailler étroitement avec nos homologues à l'étranger parce que oui, pour moi, il y a comme deux aspects. Si on parle d'un passeport, un certificat pour la vaccination, comme une exigence pour peut-être voyager à l'étranger et aussi peut-être rentrer dans les autres pays. On est loin d'être là, hein, comme le Premier ministre a déjà dit. Moi, je suis complètement d'accord. Maintenant, ce n'est pas le temps de voyager à l'étranger, ça c'est sûr. Mais si on parle peut-être un moment au futur, si c'est possible de voyager à l'étranger, oui, c'est important d'avoir des discussions maintenant. C'est quoi peut-être comme les normes standards parce que c'est plus efficace si plusieurs pays s'alignent pour avoir comme un processus, même un passeport qui est comme pareil partout. Donc, ça, c'est une conversation continue à avoir avec nos homologues pour les voyages à l'étranger. Mais ici au Canada, c'est quelque chose. Il y a beaucoup des enjeux. On a déjà constaté, je pense que moi, j'ai même précisé à des autres points de presse qu'il y a des enjeux d'éthique, de stigmatisation, de discrimination, d'équité. Donc, c'est pas si facile de dire, OK, on va donner un passeport de vaccination à tout le monde qui a eu un ou deux doses. Même à l'échelle technique, on sait que après même 2 doses de vaccin, c'est pas sûr parce qu'aucun vaccin est 100% efficace. Donc, c'est toujours possible que quelqu'un qui a déjà eu les 2 doses de vaccin, si c'est peut-être Pfizer, Moderna, c'est possible de rester encore susceptible à la COVID-19 et même peut-être capable de transmettre le virus aux autres. Donc, il y a beaucoup de questions, des enjeux, mais on continue à suivre la science qui continue à évoluer. On va regarder toujours les données probantes, l'expérience des autres pays et on continue à travailler sur le dossier. Merci.
Thank you. We'll return to the room for a few more questions. I know we're running a bit short on time, so we'll keep our questions and answers hopefully as efficient as possible.
Glenn McGregor, CTV News. Question for Dr. Tam. A lot of Canadians were tuning into this today, I think, for some clarity from you after Nassi's remarks. Now you're saying the science is evolving and they aren't given any more clarity on this issue of whether they should or shouldn't take the AstraZeneca shot or wait for an mRNA vaccine. Now you're saying, a few moments ago, Dr. Tam, that location is a factor here too. You're saying people in PEI may have a different decision than somebody living in downtown Toronto. How could anybody now make a decision on whether they should take an AstraZeneca shot, given all these different streams of conflicting advice? Why don't you give some clarity on this for that one person? And I asked the Prime Minister this and he didn't answer. I'd like to hear it from you. If someone's got an appointment to take AstraZeneca today, say in North Bay, Ontario, should they go or not?
So, thank you for the question again. as I said, that I can sympathize with people because they find it hard to follow the evolving advice. But I think all medical officers of health have taken into account NACI's recommendations, and they're rolling the vaccines according to their assessment of the benefit and risk. So do follow your local public health advice. And so follow the advice in terms of if you're asked to take your turn, please do so and line up. I think that's the bottom line. There's still an informed consent process, though. Everyone has the right to that. So go through your informed consent in terms of understanding about the vaccine, your risk of exposure, your risk of severe illness from COVID, and the benefits of getting a vaccine and protecting yourself sooner based on the epidemiology around you. What I'm saying is that follow your local public health advice. We've always said that because they've taken into account everything, all the information available, and that they are rolling out the vaccine and in a certain order as they are expanding their immunization programs. And soon this will escalate pretty fast. So I think that's my advice. Just follow local public health and be confident that everyone in this whole line of regulator to experts to local public health have done their job and follow the instructions. But it's your right to, of course, ask as many questions as you need and take informed consent.
Dr. Tam, Mike Lecouture with Global National. I wanted to ask you about vaccine mixing. Other jurisdictions have already approved it before the UK study does come out in June. So I wanted to know where Canada stands on this, especially considering the supply issues that we could be facing with AstraZeneca and Moderna. And what's your advice to people who are already who have already had one shot of AstraZeneca and are already looking ahead to their second dose?
That's an excellent question, and I think that we're all interested in the approach of actually mixing different types of vaccines, like a mRNA following a viral vector vaccine, for example. And we are following that data. NACI is very closely. And chief medical officers have already asked NACI to provide their advice on the mixed schedule before the initial people who got AstraZeneca vaccine is due for their second dose. So I think that, again, watch this space. The best evidence will be taken into account as available. And that, we may expect that expert advice to come. And certainly the idea is to have it before those who've received the first dose of vaccine. Science is actually, while evolving, I think all I can say is that all of the vaccines being used in Canada are targeting the spike protein. And so I think that the science will look towards whether, in fact, not just whether the mixed schedule is safe, but you may sort of look at whether that's actually an even better approach than using exactly the same vaccine for the two doses. Those questions remain to be answered, but I think there's a commitment to ensure that those who've received the first dose are given advice on the best vaccine to use for the second dose before they need the second dose.
Bonjour, Juliane Lapointe de Radio-Canada. Peut-être une question pour le Dr New. On comprend que la majorité des Canadiens ne sont pas des experts en santé, mais là, ce qu'on demande, c'est que des non-experts en santé déterminent eux-mêmes si les avantages de se faire vacciner avec un vaccin X sont plus grands que les risques. Est-ce qu'il n'y a pas justement un danger avec tout ça, un danger de désinformation, mais aussi de confusion générale si on demande à des non-experts de déterminer eux-mêmes ce qui est bon pour eux?
OK, merci pour la question. Si je comprends bien la question, si vous parlez des non-experts, vous parlez de monsieur, madame, tout le monde qui peut-être doivent prendre une décision éclairée pour accepter un vaccin, c'est ça?
Oui, exact. Les non-experts, monsieur, madame,
OK,
tout le monde,
bon,
les
OK.
Canadiens, là, qui vous parlez aujourd'hui, là.
OK, c'est bon, OK. OK, oui, mais je pense que, comme Dr. Tam et moi, on essaie d'expliquer, oui, c'est compliqué, ça peut être difficile pour tout le monde de comprendre, mais avec le CCNI, le Comité consultatif national de l'immunisation, c'est un groupe d'experts avec expertise dans plusieurs domaines. Et eux, ils ont fait leur déclaration hier concernant l'utilisation de vaccins Janssen, mais aussi avant pour AstraZeneca et les autres. Ça, c'est clair. Donc, après, c'est vraiment les médecins hygiénistes et aussi les autorités de santé publique dans chaque province et territoire qui doivent prendre en considération les recommandations du CCNI, mais aussi le contexte de l'épidémiologie, c'est quoi la situation sur le terrain dans leur propre province et territoire. Donc, je pense qu'en fin de compte, quand Dr. Tam a aussi répondu ici aujourd'hui, si Monsieur, Madame, tout le monde, si on a déjà, comme dit, faire un rendez-vous pour un vaccin, on peut être assuré que les autorités, même à l'échelle locale de santé publique, ont bien considéré avec les doses disponibles, avec l'approvisionnement, avec tous les outils disponibles, les trois vaccins qui sont maintenant actuellement ici au Canada, parce que le quatrième Janssen n'est pas encore disponible au Canada. C'est sûr que le vaccin qui sera offert, c'est une bonne idée de peut-être poser des questions parce qu'on veut toujours prendre une décision éclairée. Mais en fin de compte, je pense qu'avec beaucoup de confiance, monsieur, madame, tout le monde peuvent accepter l'information crédible selon le fournisseur de soins de santé, aussi les autorités de santé publique, et pour accepter le vaccin. Si c'est AstraZeneca, en confiance après avoir une bonne discussion avec la transparence et aussi avec toutes les informations fiables et crédibles qui sont disponibles.
Hi, it's Tom Perry from CBC. I just want to ask Dr. Tam, just so that I'm crystal clear on this, is your advice right now for people who got the first dose of AstraZeneca, is your advice right now for their second dose to go ahead and get AstraZeneca, or is it right now to wait and see whether it makes more sense to take Pfizer, Moderna, a different vaccine for a second dose?
Yes, I think the current recommendation is to use the same vaccine for the series for a multi-dose vaccine. But just to indicate that there'll be further advice forthcoming on that second dose based on the evolving science as well. So I think what I said was essentially, there will be further clarification and advice prior to individuals getting the second dose, and that we should watch that space.
Thank you. And that concludes today's press conference.
Hello everyone, bonjour à tous. La dernière année a été difficile, mais ce qu'on a vu, c'est que les Canadiens sont là les uns pour les autres. Tout au long de cette pandémie, on a su qu'on pouvait compter sur nos voisins et sur nos proches, or even go out of their way to protest public health measures and disrupt vaccine appointments. But here's the thing. The reason so many Canadians are following public health measures isn't just because they want things to get back to normal. It's because they care about their neighbors and about our frontline workers. It's because they know people who are vulnerable, people who could die if this virus keeps spreading. These protests are supposed to be about getting back to normal, but by spreading the virus, they do just the opposite and prolong lockdowns. So follow public health advice, but don't do it for me or for any politician. Do it for someone in your life that you care about. Do it. Thank you. As you do your part, know that we have your back. Across the country, we're deploying additional support to provinces and territories that have been hit hardest by this third wave. For Alberta, we continued reaching out to the province through the week. For Moderna, we're picking up our next shipment tonight in Europe, and by tomorrow morning, 1 million Moderna doses will be on the ground in Canada. Almost all of these doses will arrive in provinces and territories by the end of the week. This will go towards everything from hiring nurses to getting PPE to the front lines. Dans le budget de 2021, on prévoit aussi investir plus d'un demi-milliard de dollars dans une stratégie en matière de santé mentale et de bien-être, en veillant à ce que tous les enfants reçoivent une éducation de qualité adaptée à leur culture. Le but est d'écouter ce dont les communautés ont besoin et de voir comment on peut continuer à avancer ensemble sur la voie de la réconciliation. Everyone should have access to continuous infrastructure projects, whether for roads or schools. This will close gaps that far too many people still face and support good jobs across the country. Together, we can and we will continue to move forward. De réduire de 25% le coût des services cellulaires et sans fil. Aujourd'hui, on a vu les derniers rapports sur les prix moyens d'un forfait de données et d'un forfait Internet à domicile. Les prix ont baissé de 9 à 28%. C'est une nouvelle encourageante. On est sur la bonne voie. Maintenant, content de passer la parole à la ministre Anand. Anita.
Thank you, Prime Minister. Today, I will provide you with an update on vaccine deliveries into this country. En date d'hier, plus de 16,8 millions de doses de vaccins contre le COVID-19 sont arrivées au Canada. At front, the 1 million Moderna doses, originally anticipated to be picked up next week, have now been picked up, and they are en route to Canada and scheduled to arrive early tomorrow morning. I can also tell you that Moderna has been working with our department at PSPC. 1 million doses will be in Canada before the end of the week. And arrivals of the Pfizer vaccine continue to be on track for 2 million doses